Hello, I'm Dr. Vivian Opera, and I'll be taking you on the NAC OSCE approach to adult respiratory distress. Please note that this presentation is strictly for educational purpose. There are some key points you should take note of during your examination. 1. Read the instruction at the door properly and take note of the setting in which the case is being presented. This will help you during your post-encounter probe in making your management plan. 2. Take note of the duration of the presenting complaint. It will help with your working diagnosis and differentials. 3. Note down the specific task that is requested of you. This would help guide you and make sure that you complete your task. Remember to take consent from the patient and thank the patient at the end of your interaction. Another key point to note is the use of open-ended questions alongside with your closed-ended questions, using transitional statements and the 5 model. 5 meaning feeling, ideas, fear or concern, and expectation. These set of questions will help make your interaction with the patient more patient-centered. Finally, summarize your key points at the end of your interaction. As an introduction, adult respiratory distress is acute respiratory distress syndrome seen in adults. It is an acute, diffuse, and inflammatory form of lung injury, usually associated with a variety of etiologies. When taking history from a patient presenting with acute respiratory distress syndrome, you should first introduce yourself and confirm that the person you're speaking to is the right patient. Then proceed to get consent from the patient. You can then start exploring the presenting complaint, starting with the history of presenting complaint. Ask for the onset, the cause, the duration. Ask for aggravating or relieving factors. Ask for specific timing when the symptoms are worse. And also rule out if this is a first episode or if this is a recurrent episode. This would help you to know if the patient's symptom is getting worse. Proceed to ask for associated symptoms that might be present alongside with the presenting complaint, as well as red flags, such as fever, night sweats, weight loss, changes in appetite or bowel habits, fainting, or disorientation. Also ask for risk factors. This will help rule out your differential diagnosis and rule in your working diagnosis. Then proceed to the past medical history. There, ask for history of allergies to food, animals, and medications. Also ask for medication use, either over the counter or prescription medications. In your medication history, ask for recent change in medication or an increase in dose. Ask for chronic conditions for which the patient sees a physician regularly. Proceed to screen out the past surgical history, past psychiatric history for panic disorders or anxiety disorders. If your patient is a female, ask for her last menstrual period and gynecological history with emphasis on use of oral contraceptive pills. Then ask the patient for family history, social history, and at the end, summarize your pertinent points. Post-encounter probe, you'll most likely be asked different questions. Things like, what are your differentials? What investigations would you do for your patient? What diagnostic criteria can be used in making a diagnosis for your patients? What is your management plan for this patient? And what are the complications that can arise in your patients? Thank you very much for listening.